Hello, thanks for joining. I think people are joining now. My view of what's going on is slightly restricted because we're on Teams, but we'll give it a few minutes for people to join. But thank you for those who are joining now. Just going to give it a couple more minutes while people join. Uh, I'll be strict on the cut-off point. Hello to everyone joining. Yeah, please feel free to introduce yourselves in the chat. Be great to see where you're coming from, where your service is, and yeah, thanks again for everyone joining. I'll give it one more minute and then we'll crack on. Nice, everyone's introducing themselves in the chat. Great, everyone. Thanks for coming. Oh, nice, people from all over. Um, well, I'll get started. So we're prompt and to time. But again, thank you everyone for joining. It's lovely to see all the names coming through in the chat, people from all over joining, which is fab. My name's Eve McCallum. I'm the Partnerships Programme Lead in the Faith and Community Development team at Housing Justice. A quick few housekeeping points before we start. If you could use the Q&A function throughout the session rather than the chat for questions. Obviously, introduce yourself in the chat, but for questions, if you use the Q&A function, because we'll be keeping an eye on that for questions as they come in, and it just helps us to make sure that we don't miss anything that might be coming through. We'll be leaving time at the end for questions and discussion about the report. Also be sharing a link to the report in the chat so you can access the full findings and recommendations that we'll be going over today. And just to say this webinar is going to be recorded and shared with everyone who's registered and attended, but it'll also sit on our website afterwards. So if members of your team haven't been able to join, or you want to kind of share it more widely afterwards, you'll be able to catch up on anything missed and share more widely after that. But yeah, really glad to see such a wide range of people joining from homelessness, faith and community organisations, local government and MHCLG as well. And so welcome. And just at the top, I think myself, Housing Justice and the researchers would like to say a really big thank you to everyone who contributed to this research. We've really appreciated, every survey response and all the time that people took to share their experiences and insights. Also very grateful to colleagues at Homeless Link for providing us access to the Homeless England database, which helped us reach such a wide range of services. And special thanks goes to the teams and people who welcomed us for the case studies that really bring this research to life. So Catching Lives, Emmanuel House, Homeless Action Barnet, Somewhere to Go, and Springboard at Harrogate Homeless Project. We're incredibly grateful to the staff, volunteers, and people accessing the support who gave their time and shared their experience. Which, like I say, really helps bring the research to life. Before we kind of get into the findings, I wanted to spend a few minutes talking about why Housing Justice commissioned this research and why we think it matters. So for many years, Housing Justice's faith and community development work has had a really strong focus on emergency accommodation and night shelters. And we've supported those services directly through our quality assessment framework, or quality mark as some people might know it. We've gathered evidence about that part of the sector through our impact portal, and we've carried out other bits of research to better understand the role that these services play within the homelessness system. But alongside that work, we've always engaged with day services. Many shelters have either operated day services alongside their provision, or have, especially post-COVID, evolved into providing data and services as well. But I think the work that we've been doing in that area has maybe not been as intentional or clearly defined. At the same time, our policy work and kind of influencing work has increasingly highlighted the need to think beyond accommodation alone and bed spaces, and to recognise the wider range of community-based support, which kind of helps people who are experiencing homelessness. One example of that was our advocacy around replacing the Night Shelter Transformation Fund with a broader, more flexible funding programme that could support a wider range of community responses. So we were really pleased to see that reflected in the current Ending Homelessness in Communities Fund. Despite, though, the kind of huge role that day services play, there's historically been relatively little research focusing specifically on them. And that's important, because day services are often working with people who have fallen through the gaps, people who may not meet statutory thresholds for support, people who struggle with formal appointment-based systems, and people facing kind of complex barriers to accessing support. So we commissioned this research really to better understand how that support is being delivered by faith and community-based services, what challenges those organisations are facing, and to ultimately raise the profile of day services with policymakers and funders and the wider homelessness sector. So, yeah, I mean, today is really about bringing the research to life. We're joined by Becky Rice, who led and authored the research, and who's going to take us through the key findings and what day services told us about their experiences. I'm also really happy to be joined by Tasmin Maitland, who's CEO of Catching Lives, which were one of the case study organisations featured in the report. And following Becky's presentation, Tasmin's going to help us move from the research findings to like reality of what delivering a day service looks like, what makes the model work, the importance of community and connection, and the partnerships that take place to make that work as effective as it really is. And then I'll come back at the end and reflect on what some of these findings means for housing justice, and we'll reflect and try and answer any questions that come up from everyone at the end. So I think that's everything from me for now. So I'll pass over to Becky to go through the findings.
Thanks, Eve. I'm really happy to be here this afternoon to present the findings of this research that I undertook in partnership with the Housing Justice team over the last few months. I'm going to give an overview of the findings. There's so much more to say, so please do check out the report that's been published now on the Housing Justice website. I'll touch on the aims and methods we used, findings with a particular emphasis on describing services, 3 key themes around the unique nature of day services and their offer, the integrated nature of day services currently in England, and also the theme of prevention, day services role in prevention. Look at the challenges faced by this part of the homelessness sector, and think about the future for day services and outline some recommendations. So as Eve explained, we were looking really to understand and describe how day services are working, look at what kind of support this group of services needs to develop and thrive, and through the onward work of housing justice with the findings, to increase the profile and understanding of faith and community-based day services. So what did we do? We did some data analysis so that we could map day services as best we're able to, bringing together what we know from different sources of information. I'll explain a little bit more about that shortly. We did an online survey to get perspectives from as many services as possible. We got 90 responses, which is about 40% of the services that we identified in our data analysis. It's a really strong response rate, and we're really pleased with how many responses we got. So thank you to everyone for those. With the case studies, I attended each of the case study projects, usually with a member of the housing justice team. We spoke to leaders, people accessing the services, and to the teams as well. And after those visits, I also spoke to stakeholders in each area to get external feedback. That was usually someone from the local authority and someone from a partner agency, outreach, drug and alcohol services, or health. So our data analysis, we were looking to just identify as many services as possible and kind of map out day services around the country. So as Eve was explaining, Homeless Link kindly provided us back-end data for the Homeless England database. And then Housing Justice internally keep a tracker of all the services that they work with, and that lists the project and then identifies the type of service that that organisation is providing. So it indicates whether there's a day service there. And on the Housing Justice database, that includes a kind of evolving daytime offers. It's not just services that identify as a day centre. With the Homeless Link database, we used all organisations identifying as a day centre, all projects identifying as a day centre. There wasn't a huge amount of crossover from the two information sources. 20 projects were on both. 59 were on housing justice only, and 153 were identified in the Homeless Link database only. This provides a regional breakdown of the day services that we identified, with more services in London and the South East than other areas. The regional breakdown broadly corresponds to levels of rough sleeping as identified in official figures. But still, it looks like there's probably more work to do to kind of reach services in some areas and try and extend the reach of the work that Housing Justice does and identify additional services, particularly maybe in the North East, Yorkshire and Humberside and the East Midlands. So in terms of defining services, we wanted to reach services from across the faith and community sector and be a little broader than day centres. There's a couple of emerging definitions to kind of set the context to the rest of the findings. These came from work with the team before the research and from survey findings. So day services are nearly always place-based, local, non-accommodation services, providing a vital point of contact. They nearly always focus on those who fall through the safety net and nearly always provide essentials, so meaning charging for phones, showers, food, clothing and laundry, casework and advocacy, and relationship building. Another concept that we used that was strongly identified with was community hub, and that is to explain that day services are nearly always a single location, acting as a multifunctional space, providing access to a range of services from one space, with integrated provision, usually featuring some kind of in-reach service from other external organisations. So in terms of the faith identity of services, it was really, really mixed. The most commonly identified was faith-based services, which was over a third of services. A third identified as community-led, non-faith. Some of those have really strong links with faith communities, for example, through volunteering and fundraising. And a fifth said they were sort of both or mixed. There are a few other responses, and those included a local authority day service and a specialist LGBTQ+ service. So we provided a number of statements about the kind of identity of in terms of service delivery, how people describe their service delivery, whether they identify with these statements. The most strongly identified with was that we act as a community hub. Most services agreed with that, and most services strongly agreed with that. And then again, really high level of agreement that we're as much about community and connection as we are about homelessness. And that was something that comes through strongly speaking to people accessing services as well. Agreement was high that we focus on providing a humanitarian response for people not getting the help they need elsewhere. There was less strong agreement with that statement, probably because, as the comment on the right-hand side shows, because services provide so much more than that, the kind of basic humanitarian response is foundational to so much other work that comes after. Maybe it didn't feel quite as comfortable to strongly agree with that statement. And most agreed they're the main place locally for people experiencing rough sleeping to go during the day. In terms of who services are currently broadly serving, the most common was a broad definition of people experiencing homelessness is the main group being served by services. So that includes people who are experiencing homelessness, including rough sleeping, but more broadly. So those sofa surfing, living in poor conditions, often including those living in homelessness accommodation and maybe facing some issues there as well. The next statement with the highest level identifying with that was people experiencing homelessness and those who have moved on from homelessness as well. There's still a significant proportion, nearly a fifth, who serve a wider group experiencing poverty and social isolation. Only 6% reserve their services primarily for those currently rough sleeping. There are a lot of other responses, which was often where it was combinations of those different response options, perhaps at different times of the day or week. A few more points about typical day services, just to go through these quickly. Typically really small organisations, over half have 3 to 10 staff, and then about a quarter have fewer, 1 or 2 staff, plus lots of volunteers, and then the remaining quarter were bigger than that. Most are operating all year round, usually 5 days a week, but a significant number opening at the weekends as well. Most have their own dedicated space, and a high proportion, 58 of those responding, have a night shelter associated to the service. Okay, I'm now going to talk about the 3 key themes identified that really kind of these 3 themes together provide an overview of the contribution that day services make. So firstly, day services are unique and valued. I've taken feedback for this summary from stakeholders and people accessing services rather than the services themselves. So from stakeholders, often commenting that day services are the only place for people to get essential services, a place where people who are stigmatised and excluded are valued, and providing an independent voice and advocacy, particularly important for people who have struggled to access commissioned services or local authority services. From people accessing services themselves, the emphasis in terms of what's unique about a day service compared to the other services on offer is that help to survive and function, including phone charging, showers and food. And that's nearly always backed up also by a sense of relationships and trust, being welcomed when turned away elsewhere, somewhere you can spend time and connect with others without having to be doing something specific or attending a particular appointment, and independence to help find the best route out of homelessness. So a few quotes to illustrate the unique contribution of day services and how they're valued. Someone accessing the service explained that the service helps them operate almost normally, like you're not homeless, because you can get the essentials like meals and showers. It's giving you that kind of base to hold on while you don't have somewhere. Yeah, it's life and death is everything. The second one is also from someone accessing a service who said they're really good people. Some people come here and they're just down and lost. By the end of the day, they've had something to eat, got fresh clothes and a plan of attack. And that person was talking to me and referring to a young person who'd come in and the kind of change that he'd seen in that young person over those few hours. Thirdly, from a partner agency who said, we always refer people to Springboard. It's the only place people can go for showers, laundry and food. We really do rely on them to be that place people can go. Okay, so the second theme was integrated. And I think this is something that's been developing over the last decade or longer, is how integrated day services usually are in terms of the local homelessness services that people access. So for people experiencing homelessness, how they experience that integration, often through InReach. So InReach is typically health, DWP, housing options, substance misuse, and also referral. People often are overwhelmed with information, don't know where to go. So that kind of helped to initially navigate and get an active connection with other services. And then those who need it, it's that advocacy, being able to push for action and help people to explain their needs. And then safeguarding and multi-agency work. Every area I went to, the local authority commented about the way that day services often have all the communities that they work with, often are able to help locate, identify and connect with people who perhaps there's a concern about. So there's that real strong role in safeguarding. In terms of more strategically, how services are integrated in the local system, again, this is a picture of a really high level of involvement and engagement in planning, a strong role in planning and partnership work. Nearly 3 in 10 said they had a leading role, so chairing or co-chairing forums, for example. Similar proportion said they're fully engaged and actively involved. For a fifth of people, they are consulted and involved, but would like to be more deeply involved. And then 16% said that they're not currently involved enough and would like to have more influence. A small number are rarely involved, but want to retain that level of independence. So a few examples of integration. The first one referring, so this is a partner agency referring to Catching Lives in Canterbury. It's become over the years much more of a multi-agency hub, a beacon for people, and has a crucial role in safeguarding. And then from the local authority in Nottingham, we've always had a good relationship. They're involved in everything we do. They're just an integral part of what we deliver as a city. And then from that person accessing services, a woman told me that is knowing you've got a place where all the services come in and you can arrange to see them. That's huge. I've referred myself for drug treatment and couldn't get anywhere. It was only when I came here to see someone face to face, things actually started happening. In terms of prevention, so very strongly, most services identify that they work to prevent homelessness as well as responding to it, 87% agreeing. It hides quite a level of complexity. A couple of really helpful comments, I think, from survey respondents. One person explaining that it's a broad term, they feel, with many different interpretations, and we're interested in preventing homelessness at the point of crisis. To try and do so earlier would spread our resources too thinly. And someone else commenting, we'd like to see a shift for all agencies to be able to work more in prevention rather than response and crisis management. I think illustrating or making the point that without support and investment, that's support and investment is needed for day services to get more involved in early prevention. That said, there are some really interesting examples going on of shifting prevention upstream in day services a bit. In Barnet, they're helping to pilot the Ending Rough Sleeping assessment tool, which helps to ensure people don't have to be verified or seen rough sleeping to get assistance. And in South East London, a group of day centres are part of a pilot with earlier prevention work happening. But the main areas of prevention, I'm going to go through 3 now. The strongest areas of prevention that were identified. Firstly, tertiary prevention, ensuring homelessness is not repeated. So the mechanisms for that include a safe and familiar open door when issues arise. That's often when people have issues with benefits or a problem in their supported accommodation, for example, people have a place to come back to, and they're able to get that help to prevent repeat homelessness. Another area of prevention in terms of preventing repeat homelessness is ongoing connection, meaning, and support. And there's really diverse approaches to this. All services comment that they seek as part of this to try and connect people to things that are outside of the centre, but many people still have a really strong association with the day centre, and in a lot of centres there's scope for that. Again, really diverse approaches even within that. So, for example, where part of the day is reserved for those currently experiencing homelessness, another part of the day, anyone is welcome, or anyone is welcome if they want to take part in an activity. To in Weston-super-Mare, that large space is currently nearly always open to anyone who wants to come along, and people do for that ongoing connection. And then aftercare and resettlement roles. This was something that some services providing and other services are often keen to provide, to extend that kind of tertiary prevention role in a more targeted individual way. Another theme in prevention was, the second theme in terms of prevention is emergency prevention. So ensuring that homelessness is as brief as possible. And key mechanisms for this are that on-site access to support, somewhere people can go to get help rather than waiting to be found by outreach, active referrals, and being a place people trust to give them the right information to advocate for them for the best routes off the street. Then finally, another area of prevention that came through really strongly was health and harm minimisation, and in terms of preventing escalating health problems. And that's achieved through access to health and substance services on site, providing connection and structure for people to ensure their mental well-being, and being there for the long run. So for those who are experiencing repeat homelessness, somewhere you can come back to. A couple of quotes to illustrate those last health points. So the person accessing service at the top had been experienced homelessness first, rough sleeping in a smaller town without any kind of homelessness service. And he'd deteriorated really badly and explained going for days without showers, days without clean clothes. That's why the crisis team got involved and I was sectioned. It got to the point where I was nearly going to kill myself. That's how low it goes. He experienced homelessness as complete hopelessness and isolation. When he moved to the larger town with the day service, it was completely transformative for him accessing that service. Another example in terms of more harm minimisation and community is someone who is struggling to access the recovery support that he needs, the addiction services he needs, but feels that the day centre provides routine. Coming from an addict background with a lot of turmoil and chaotic storm, it's safe, it's socialising, and it's having interaction with people. And he explained that attending the centre increases his desistance for the days when it's open. So in terms of the challenges facing day services, it's a network under extreme pressure. The three biggest challenges identified by day services in the survey and in the fieldwork case studies were managing demand in the face of increases in rough sleeping and homelessness, being overwhelmed, sometimes having more people than it's easy to manage within the space, having more people where it's hard to find solutions, those with complex needs, for example, and those who have got uncertain access to public funds or no access to public funds. Funding stability, I'm sure it won't surprise anyone on this call, is a critical issue. Services particularly struggle to get funding for the foundational essential services. There's an increasingly challenging environment in terms of grants available to homelessness services. So it's an ongoing challenge and existential risk to many services out there. And then premises and buildings. While there are some great welcoming spaces, every space we visited needed investment of some type, whether that was in terms of the ownership of the building or the lease of the building, leaks from the roof, not having an equipped medical room, there's usually something that is needed in terms of creating the right environment. So what's the impact of that operating context? It means that sometimes services have to focus on the basic provision and have less time to do the more detailed, focused or targeted work that they'd like to do with people. Being limited by the space, so for example, where there's no clinical room, that limits the in-reach that's able to happen, and being less able to prioritise areas such as resettlement, prevention and intensive service navigation. So in terms of the future, despite the challenges, day services are a resilient and quite optimistic group of services, and over half of the people responding to the survey are planning to expand and develop. And the case study areas all had amazing plans if they can only resource them. Another 40% plan to maintain, and most of the others were unsure at the current time. So areas that services would like to develop include intensive casework. I think there's an awareness in many services that they would like to develop their offer for those who are not as well served by a day centre environment or day service environment, so offers for women and younger people. Extending resettlement offers, and also increasing outreach and community-based support. So taking the skills in that staff team and reaching out to other places where there might be people at risk of or experiencing homelessness. So finally, recommendations. So day services, as we've seen, unique and valued and integrated into homelessness pathways for people. They need recognition and resources, including sustainable core funding and the ability to invest in buildings and the workforce as well. While that kind of investment is needed, it's really important to preserve the unique characteristic, including day services are usually independent and deeply connected with and trusted by the local community. Services need to be supported to better capture outcomes and therefore have a greater influence locally and beyond. The community hub model should be recognised, where essential services and a relational approach leads to an array of services and then the onward outcomes. Consistent in-reach from local services should be an expectation. Services should be regarded as local experts and consulted and involved. And opportunities to extend prevention work, including resettlement, should be resourced and supported. Okay, I'm going to finish there just with some photos, really nice photos that the case study areas sent to us, and echoing Eve's thanks for all the support everyone gave us with this research. Okay, I'm going to hand over to Tasmin now to provide a case study.
Thanks, Becky. Hi all. So yeah, Catching Lives is one of the case studies in this research, and I'm Tasmin Maitland. I'm the Chief Executive there, and I'll talk through a bit about our model and what we're experiencing at the moment. I'm sure a lot of it will be familiar to those of you on the calls from other day centres. So if we go to the next slide. Thanks, Becky. So, I mean, we are, our work will be familiar to a lot of you. It will have similarities with a lot of other day centres around the country. We are a relatively small day centre. That's our building. It's a formal newspaper warehouse. It's industrial. It's not built as a day centre. So it effectively has one large room divided by double doors with smaller rooms around the outside. But it's quite basic in its sort of sense, its functionality. It's not hugely flexible for us. We open 7 days a week. So pretty much 365 days a year, and we serve people who are adults 18 plus who are homeless or insecurely housed. So that across all kind of rough sleeping, hidden homelessness, temporary accommodation, different situations that people might be in. We have 3 main streams to our model. The first is essential facilities, so food, showers, laundry, device charging, bag storage, computer access, care of address, the essentials that people need. And we provide that so that people can then engage with the one-to-one support with our project work team and to get help with whatever's going on for them. And that's often housing, health, income, and other things they might need support with. So we will try and respond to whatever that person needs and provide a tailored response and try to work out, can we provide that help? Can we signpost elsewhere? Is there advocacy needed? Like, what can we do? And we'll move at people's own pace. If somebody's not ready to complete an assessment with us, if they're not ready to share that much information, we'll give them time and space to do that and let them decide at what point they want to engage, but we will keep making that support offer. And we're trying to make sure that we're a proactive enough service that we're not only reacting to those people who are asking for help all the time, we're also making sure for everyone who's coming in, are they getting the right offer? Have they had an offer of support? Has it been repeated? Do they feel comfortable to talk to staff? Because it's a lot of people in one space, so trying to make sure we're providing an offer for everyone if we can. At the moment, we're seeing an average of about 33 people a day, but it does vary greatly. So I think this week we've had a day with over 40 people, and we can suddenly hit a sort of a period where we're seeing 45 to 50 people quite regularly, and it's not always clear why that's happening. So we have to respond as we go, and we always try to provide that service and not to turn people away at the door. So on a case-by-case basis, anyone who comes to us and says, I'm having issues with my housing, we'll try and see what service we can provide for them. Alongside the essential facilities and one-to-one support, we also have a programme of activities. So that's usually 4 afternoons a week, and that's lots of different activities and will be guided by people about what they would be interested in. So things like arts, gardening, cookery, yoga, tai chi, board games. So it will change from time to time depending what funding we have, what the people using the service are interested in, and also if we have like occupational therapy students, they might offer particular activities. So that's more focused on social connection, skills, creativity, and people can only stay in the building between 2 and 4 if they're taking part in the activity. So it provides from the morning drop-in, which is usually 9 till 2, which is quite hectic, can be quite chaotic. So a lot of people in one space. You're walking straight into the middle of that space when you walk into the day centre. But from 2 o'clock, it creates a more focused, calm environment. And we have a very different type of engagement with people at that point. And particularly for some people who might feel more vulnerable in the space or less confident to talk, the activities allow a different sort of engagement and communication. So that's an important part of what we do. Alongside those kind of 3 main strands, we're also a multi-agency hub, and I'll talk a bit more about that. We're relatively small. We have a team of 12 normally. We are, I think, 9 at the moment. We have a lot of volunteers who help as well. And we have students on placement who sort of back up the team with that. In the past, we have provided either a night shelter or evening drop-in in the winter months. That's not something we did last year. It's not something we're committing to in the future. A 7-day provision is kind of plenty for us to be getting on with, and it's challenging enough to secure the funds to deliver that service. So we're focusing on creating a more sort of proactive, slightly more structured day centre service that's really working on a case-by-case basis to try and engage with people and help them. We specifically work with that broader client group and not only people sleeping rough. We're the only homelessness day centre in East Kent, so we get people travelling to us from quite a lot of different places, Thanet in particular, but Canterbury also goes up to the coast with Whitstable and Herne Bay. So geographically, we have quite a wide area where people will be coming to us for support, and we want to provide as much support as possible to help people before they become homeless, but also people transitioning out of maybe prison, hospital, other situations into housing. And if they need something, we can sometimes provide that brief intervention and help them to get on their way. We also transition people out of the day centre. So the drop-in is open access, breakfast and lunch. But once somebody's had support and we've worked with them and we're confident, you know, they've maybe moved into housing, they've got their benefits sorted out, perhaps they've got support attached to that housing, we would then reduce access and say, actually, the drop-in isn't something that you need anymore. At this point, the activities are always open to you, but the drop-in is for people who are in more crisis, because otherwise we can't really manage the level of need for our service. So that kind of transition is quite an important part of what we do. And we do that again on a case-by-case basis. If people get stuck and need help, they can call us. You know, they may be having problems with their income, with paying a bill. They might be having problems with like maintenance at home or with roommates. And so we can then help at that point and step back in and work with them again in a more structured way. But we do have to manage the access to the drop-in, because it can get, it's, you know, with a small staff team, it's a lot to manage. So that's the approach that we take to try and meet the needs of as many people as possible while providing a decent quality of service as well. Have the next slide. So we act as a multi-agency hub, and this is a really important part of what we do. It's something that has been developing, and we've been really pleased to see it kind of extend, and to have a really positive response from the agencies that we work with. It's something that has grown in the past few years. So we have weekly drop-ins from people like Forward Trust for substance use support, Rising Sun around domestic abuse support, from the Rough Sleep team from the council. We have lived experience recovery mentors, and NHS complex needs nurse for physical healthcare, a morning a week. And quite a new addition to that is an NHS rough sleep and mental health practitioner who comes in at the same morning as the nurse. So we have that sort of NHS presence, and that's been amazing. We also do sort of quarterly health days. That's where the photo's from. So the Dentaid van, Hep C Trust, maybe things like cancer screening or smoking cessation. So quite a wide range of agencies will come in for that. And we'll work with different people as we go, and trying to provide as much as possible for the people we support in one place. The primary reason for that is to support those individuals and make sure they've got what they need in one place, but also it can really help. It helps other agencies. It's more efficient. You don't get as many missed appointments. They can come here and meet people where they're at, knowing they're going to be getting breakfast and lunch, so it's a more reliable point of contact. But also for the staff team, I think it's really challenging in day centres. We're working with so many different people and so many different needs, that maintaining staff morale and understanding the best way to work with people, if we're doing the right thing, if there's more we could be doing, what our risk assessment is like, and our safeguarding. And having other agencies on site has been really important for team morale, because you can just say, actually,